Super, merci bien.
Okay. Are we ready? Do we have Sophie online? Awesome. Well, thank you so much, colleagues, and very much thank you for making the time on this last hour of the day to join us what would otherwise have been a missing conversation in this session when we talk about the role of human rights in sustaining the HIV response. Before we start, I just wanted to quickly make an announcement logistically that we are not allowed to take photos unless designated, and we already have designated photographers. And thank you, Patty and Leora. And we also do have French translation. So English will be channel 2 and French will be channel 3. So welcome again, colleagues. My name is Nomtika Mjwana. I lead the human rights strategic pillar within Frontline AIDS, and I will be the moderator for this session. We at Frontline AIDS really appreciated the elevation of the resolution 56/20, which was put forward by the drafting group led by Brazil. And this is important in our work and in the human rights sector, because our work includes supporting communities working with HIV, with key population in all their diversities, to document and respond to violations through our program REACH, specifically REACT, and also enabling urgent protection and emergency responses through the Rapid Response Fund, as well as strengthening civil society advocacy through initiatives like the REACH program. And our work also involves providing public human rights-centered messaging and technical inputs into policy and programmatic frameworks. And these efforts are then cascaded into regional and these global advocacy fora, connecting national leadership.
Connecter le leadership national et les priorités dans les espaces internationaux. Je voudrais d'abord reconnaître toutes les personnes qui ont rendu cet événement possible. OK.
Yeah. With translation? Great. So I wanted to acknowledge everyone who's made the session possible.
Je voudrais reconnaître toutes les personnes qui ont rendu cette session possible, nos partenaires qui co-sponsorisent et qui soutiennent cet événement, particulièrement ONU-SIDA qui a toujours soutenu ces discussions et ces conversations afin de s'assurer que les droits humains restent centraux dans la question de la réponse en matière de HIV-SIDA et particulièrement avec une mention particulière pour le groupe de rédaction sur la question du HIV porté par la mission permanente du Brésil et co-sponsorisé par la Colombie et d'autres et qui soutiennent cette discussion à ce moment critique où nous nous trouvons. Nous nous rencontrons de nouveau. Ceci aurait eu lieu de toute façon, comme si le rapport avait été présent, mais nous avons déjà cette session de pré-panel dans la session de mars des droits humains, la 58e session, et ceci était un appel. Et donc, dans cet espace et dans ces processus de durabilité, les directives proviennent de la résolution HIV du 2024 et a demandé pour un panel de haut niveau cette année qui culminerait avec des apports de la part de la société civile dans un rapport complet qui permettrait d'avancer sur des questions vers la durabilité de la lutte qui serait également portée par ONU-SIDA. Et ceci viendrait également à un moment critique en matière de financement. Et on a tout ce que nous avons vu entre les manques de fonds et il y a une redistribution des fonds et des nouvelles autorisations, énormément de plaidoyer pour les financements nationaux également. Et il est important, alors que nous continuons de naviguer cette question, les crises, nous continuons à mettre l'accent sur le besoin de conversation alors que la réponse au VIH-Sida est toujours menacée. Nous avons un formidable panel avec tout d'abord le Thiago de la mission permanente du Brésil qui va nous donner le discours principal. Ensuite, nous aurons parlé Keren Dunaway, qui est le partenaire de ICW, et parce que nous avons avec nous des voix importantes en provenance de nos communautés qui sont absolument centrales. Il y a avec nous Monsieur Massougui Tiandoum de ANCS au Sénégal, qui parlera des outils d'évaluation du HIV-SIDA, et Blessing Kumawu du Ghana, qui parlera également d'utilisation des outils de suivi pour répondre, pour faire du plaidoyer en matière de HIV-SIDA et également pour apporter. Sophie est également avec nous dans la communauté internationale de femmes qui vivent avec le HIV-SIDA et nous partagerons une perspective en matière de droits humains sur la durabilité et de Frontline AIDS. Nous avons nos cotem Kadi et Liora qui nous rejoindront et qui prendront des photos aujourd'hui et Christine Stegling donc de ONU-SIDA. Je vais présenter les orateurs alors qu'ils se préparent à prendre la parole et j'aimerais également prendre le moment d'accueillir toutes les personnes qui nous rejoignent en ligne. N'hésitez pas à parler avec nous dans ces discussions importantes.
Have a pretty packed panel and a tight time frame. So without further ado, I'm going to introduce our first speaker, who is Tiago Melamed de Menezes. I hope I pronounced that correctly, and is a diplomat at the Permanent Mission of Brazil to the United Nations in Geneva, working on health issues at the Human Rights Council, including access to medicines and responses to HIV/AIDS. Thank you very much for making the time, Tiago. Great acknowledgement again for the drafting of this important resolution, and the floor is yours.
Thank you very much, Nomtika, and thank you very much, Frontline AIDS, for convening us here today and organizing this important event. Brazil has a long history of tackling the HIV/AIDS epidemic by establishing one of the first programs to provide free and universal access to antiretroviral drugs in 1996. It became a global leader in the fight against HIV/AIDS. This pioneering program for universalizing antiretroviral therapy drastically reduced viral transmission and transformed the disease into a chronic and manageable condition. Brazil has demonstrated that it is possible for a developing country, through engagement with academia, social movements, and global health forums, to provide essential HIV/AIDS treatments equitably, efficiently, and on a continental scale. We are once again experiencing a historical moment in the fight against HIV/AIDS, just as we did in the early 1990s when the antiretroviral therapy was first adopted. Today, we have the possibility to control the epidemic and to achieve SDG 3.3 of the 2030 agenda to end the AIDS epidemic. As president of the PCB UNAIDS, Brazil recognizes that achieving SDG 3.3 relies essentially on making new HIV/AIDS treatment technologies available to all. A recent article in The Lancet highlighted that a generic version of lenacapavir could cost significantly less, while the current cost of treatment ranges between $2,300 and $44,800 per person. Equitable access to generics could bring this figure down to $25 to $47 per person per year. Lenacapavir has the potential to curb rising HIV incidence in Latin America, a region with marked disparities in pre-exposure prophylaxis uptake, both within and between countries. Unfortunately, this region has been excluded from Gilead's voluntary licensing agreement with 6 manufacturers in 120 countries. How can we make a game-changing HIV medicines available to everyone, everywhere? There is great potential for cooperation between UNAIDS and UNITAID in addressing barriers to access new HIV treatment and prevention technologies. Brazil will work to explore this potential and reaffirms its historical commitment to the fight against HIV/AIDS, including by hosting the 57th session of the PCB UNAIDS at a crucial moment for the adoption of the next global AIDS strategy. We would also like to stress that social justice and the reduction of inequalities are at the core of our vision for global health. Brazil, therefore, supports gender mainstreaming in public health policies, while also taking into account the intersectionality of gender and race, as illustrated by the National Program guidelines and strategies for confronting HIV/AIDS and other STIs for women in vulnerable situations. Finally, I wish to underscore that the new pandemic agreement, together with the G20 Coalition for Local and Regional Production, Innovation and Equitable Access, represents a potential breakthrough not only against AIDS, but also against future pandemics. These initiatives can help us prepare by addressing the inequalities and social determinants that drive global health crisis. Brazil remains today, as in the past, as an essential partner in the global fight to end HIV/AIDS. This is a tangible goal of the 2030 agenda and one that is now more achievable than ever. Thank you.
Thank you very, very much, Tiago, and great to commend Brazil as well on just the continued fight and advocacy for affordable and accessible treatment and all the efforts and work that you have done to ensure that that happens as well. Thank you very much. So, Christine, we are back here together on this panel, and we are aware, of course, that the Office of the High Commissioner for Human Rights was meant to deliver this report, and we are in this liquidity crisis, in this financing crisis, and therefore we weren't necessarily able to have that delivered for this session. A lot is also moving and happening in the global AIDS response. So before you start, I will reintroduce you to someone who might not necessarily know you, and then I will give you the floor. Okay, Christine is the Deputy Executive Director for Policy Advocacy and the Knowledge Branch at UNAIDS, as well as an Assistant Secretary General to the United Nations. Before joining UNAIDS, Christine was the executive director at Frontline AIDS, the International Treatment Preparedness Coalition, as well as the Botswana Network on Ethics, Law, and HIV/AIDS. You are an author, you are quite notable, and a very strong and passionate advocate. So I will not read the rest of this. I will give you the floor. Thank you, Christine.
Thank you so much. So good afternoon, colleagues, member states, colleagues from the UN and from civil society. I'm really pleased to be here. Thank you so much, Frontline AIDS, for bringing us here at this critical moment, even though we may have thought we would come together under different circumstances. But I think our constant refrain at the moment is, it is what it is. And so we will analyze and we will come together even as the situation is presenting itself the way it is currently. I really want to thank Tiago, not only because Brazil is such a front runner on a real commitment to responding to HIV and AIDS, but also their commitment to a human rights response to UNAIDS, but also because Brazil is the chair of our board right now, as Tiago has said. And that is a really good thing in a very difficult year to have such a committed chair that really knows how important it is that we continue speaking about gender mainstreaming, about a human rights approach to health and so forth. So thank you, and thank you for your opening remarks. So I think the first thing to say that it's hard to miss what has changed since the Council's HIV resolution last year. I have to say, I speak a lot about that resolution. I mention it everywhere because it is such an important thing that we did and something that we carry into our conversations about the next UNAIDS Global AIDS strategy, and also as a fundamental building block for our political declaration in 2026, in June 2026. But needless to say, the landscape has altered dramatically, and those shifts are felt mostly by communities, or first of all, by communities. Prevention is being scaled back, and that is despite the fact that we have this potential game changer, and it's really interesting how Brazil is translating that potential game changer, lenacapavir. We know that supply chains and data systems are disrupted, and community organizations are being forced to stop or to reduce services. Each of these has significant implications for a human rights-based response. And this change threatens to reverse the gains made through decades of hard work and solidarity. The global community reduced the annual numbers of new infections and AIDS-related deaths to their lowest levels in more than 30 years, and over 30 million people are now on treatment. Despite the fact there are still 10 million people before even this interruption that are not on treatment. We must never forget to say that. But this is hard-won progress. But it is not yet enough to meet our targets for 2025 and our 2030 goals. You all know last year, the last year we were reporting on 1.3 million new infections were acquired, and over 630,000 people lost their lives due to AIDS-related causes. And while we are concerned that while we have been quite successful on getting over 30 million people on treatment, as I said, 10 million people remain not on treatment, and we suspect that that figure might go up as we see the full impact of this systemic shock that we're currently experiencing. And these figures, as I say, have not taken that into account yet. So we are very concerned that there will be treatment disruptions, especially for those communities that are most marginalized, and that there are less new initiations onto treatment during this period since January 2025. If major support is permanently withdrawn, modeling predicts that there will be more than 6 million additional new infections and more than 4 million additional AIDS-related deaths by 2030. So if this was just a funding crisis, that would already be devastating. But at the same time of this funding crisis, we are also seeing a strengthening of the anti-rights and anti-gender movement. We know that stigma and discrimination are still widespread amongst reporting countries, and I have to keep on saying not all countries report on this, but those that do, a median of 53% of the general population still hold stigmatizing attitudes towards people living with HIV, and more than 1 in 5 people from key populations report experiencing stigma and discrimination in the past year. This in turn impacts treatment-seeking behavior. 2024 was the first time we reported that the number of countries criminalizing same-sex sexual activity increased. Surveys show that a third of people who experience stigma and discrimination when seeking HIV care went on to interrupt or entirely stop HIV treatment at some point. We know from experience and evidence that community-led advocacy and services are at the heart of the HIV response, yet without sustained investment, their ability to complement and reinforce national health systems through pre-adherent stigma-free services will erode. And we have seen that in harm reduction services completely shutting down in many countries, PrEP programs collapsing, and community-led human rights work stalling. I know many of you in the room and online know all of this, and the reason I'm repeating it is because in the next phase of the response, if we do not address underlying stigma and discrimination, particularly in the current situation, we are in significant trouble. And we should keep on saying that to people. It's like it's something people don't want to hear. Countries are rapidly trying to restructure the HIV response with the funds they have, integrating HIV into general healthcare services where they can, and sometimes integrating key population programs or keeping separate key population programs if at all possible. But if human rights programs are not included and funded, vulnerable groups will be left behind. Community monitoring is already reporting increases in stigma and discrimination and people avoiding services as a result. So when funding falls, it is the rights work that is the first to be treated as expandable. Human rights funding is also overwhelmingly reliant on international donors. Among the countries with recent national AIDS spending assessments, more than 80% of funding for societal enablers came from international resources. With these donors' reductions, countries need to embed human rights in national systems and budgets so services remain acceptable, available, and of quality. As UNAIDS, we're working with countries to ensure human rights remain at the center of the response, and a lot of that is being done through our Sustainability Roadmap initiative, where we are providing technical support to countries to move to a sustainable, inclusive, country-owned and funded response. And in that work, the roadmap process calls on countries to include and budget for human rights work and support to communities within national responses. The UNAIDS reference group on HIV and human rights has also produced a clear set of minimum standards on human rights in a sustainable response to support countries. And if you're interested there, it's obviously online, but there are some copies outside. Sorry? Okay, I'm being told by Emily. But this work requires an all of UN and society approach. The UN Joint Programme was created in recognition that HIV is a multifaceted issue, requiring expertise and support from across the UN. And even before that, the Human Rights Commission, which is now the Human Rights Council, recognized the importance of human rights, with Brazil bringing the first resolution on HIV to the Commission in 1989. As we have already discussed on this Thursday, the High Commissioner was to have presented the Office of the High Commissioners on Human Rights' report of findings and recommendations from the March panel discussion on HIV. But as has already been mentioned, due to the liquidity crisis, this is one of the many reports that will not be delivered. And I want to be careful how I say this, and we were discussing it outside the room. Look, we are all in a liquidity crisis in the UN, and many things are not happening because we don't have the right funding. So I'm not saying that because I think it is this one report that is more important than others. There are many important reports, but we do think it would have been important, especially at this particular time, as we're going to a political declaration next year, as we're going into a new global AIDS strategy. And, you know, just just to reiterate that the panel that we happened in March was not long after these significant cuts to HIV funding happened, and it reflected the analysis of experts from community, from academia and the UN. The recommendations are critical in informing country actions as well as our upcoming strategy and any work that comes from the General Assembly. So the role of the Office of the High Commissioner for Human Rights and the Council in ensuring human rights commitments to the HIV response cannot be overstated. This is what we lose when we as the UN system are underfunded, and that goes for all of us. We need to put a clear spotlight on the human rights barriers that still undermine HIV services and ensure that discussions is grounded in evidence and the lived realities of key populations and other marginalized groups. Let's be clear that integration will not miraculously resolve the issues that have plagued us for over 30 years, and that will need a concerted, multi-sectoral, human rights-based approach. This also holds true for the possible game changer of new prevention tools, such as long-lasting injectables. We need to advocate for access and affordability, and at the same time be clear what is needed to ensure accessibility, removing the human rights barriers that will stand in the way. We must elevate the leadership of community-led organizations and hold governments and partners accountable while also supporting them to shape how those solutions are built into national plans. Most importantly, we are asking member states, UN partners and donors to renew their commitments by protecting and investing in community-led human rights-based responses. And with that, I thank you.
Thank you very much, Christine. And I know UNAIDS has been doing a lot of extensive work on the sustainability road mapping processes, along with developing guidance brief for human rights-based approaches, communities, gender and leadership, and ensuring that communities are at the center. So I do agree and really emphasize the country-owned and funded responses and needing to really address the human rights barriers, because we do see the anti-rights emergence very, very much rampantly, from conferences to really how all of that translates into policy. Another important aspect of that as well, of course, is ensuring that communities are at the center of supporting that implementation process, which is part of the work that our HIV prevention team, led by Leora Pillay, is working on with the Transition Initiative as well, ensuring that communities are actively engaged in the sustainability discussions at country level. So now we're going to take this as well to communities. I just want to quickly do a check and see if Sophie is okay and connected.
I am.
Absolutely. Thank you so much, Sophie. Hello, and thank you for joining us. So Sophie Bryant is a human rights lawyer who's currently serving as the Director of Global Programs at the International Community of Women Living with HIV, where she led the development of Confronting Coercion, a critical report that documents global patterns of coercion and mistreatment experienced by women living with HIV in reproductive healthcare settings. She holds a master's in public policy from Harvard Kennedy School and a Juris Doctor from the University of Miami School of Law. She began her work in the HIV response in 2013 as a Women's Law and Public Policy Fellow at Georgetown University Law Center. And today she will be sharing with us more around the gender and human rights perspective on sustainability. Thank you so much for making the time, Sophie, and the floor is yours.
Wonderful. Thank you so much. And thank you for holding this space for community voices and for this discussion in a moment where sustainability is too often a code for austerity. Let me start by saying that sustainability is not gender neutral. Christine shared some sobering statistics, and we can understand that the atmosphere in which decisions about sustainability, human rights, inequality are not gender neutral. And therefore our efforts cannot be gender neutral. The HIV response has already learned hard lessons that if human rights and gender equality are not at the center of the response, we cannot reach our goals to end AIDS and secure the health, dignity, and well-being of people living with HIV around the world. Without specific and deliberate inclusion and clear provisions for human rights protections embedded in sustainability planning and specific efforts to support a gender transformative HIV response, efforts at sustainability and indeed efforts at integration run the risk of becoming a race to the bottom. I want to offer 3 points. First, every sustainability plan and any sustainability plan that's being done needs a gendered analysis that is co-created with women living with HIV. This is essential. Women, especially women living with HIV, experience the HIV treatment care and maternal health continuum, reproductive health continuum through power imbalances, including disrespectful care, coerced procedures, lack of informed consent, privacy breaches, and deeply gendered inequities around bodily autonomy and agency. For women living with HIV, this has real consequences. One example is that women living with HIV have a dramatically higher risk. Apologies. They have a dramatically higher risk of maternal death, on the order of 8 times higher than HIV negative women. And this is even higher in some studies, as high as 21 times. Beyond viral suppression measures and beyond sort of vague requirements around tangible efforts at gender equality, a gender analysis must ask questions. Are women able to exercise bodily autonomy? Are there protections for informed consent? Are respectful maternity care standards being adhered to? And how are we ensuring that our sustainability efforts are taking a gender transformative approach? If sustainability efforts end up delivering fewer choices and more stigma, we're taking the response backwards, not forwards. So plans have to bake into the process a gender and rights analysis and a due diligence step from the original design, budgeting, and implementation review. That means that women living with HIV must have a seat in the planning processes with decision-making power, not token consultations, but direct voting power and engagement, meaningful engagement. I heard mention of a rights minimum package. That's great. That should be also embedded inside sustainability planning efforts and integration efforts. We need to ensure that informed consent is upheld in practice, that confidential counseling is preserved, and that there are remedies for human rights violations. Secondly, my second point is that we talk sometimes about the role and the benefit, particularly of women-led responses, of community-led responses, but particularly women-led responses. And they're often an afterthought, or they're often a nice to have, but not recognized as the essential piece of the HIV response that they are. And sustainability demands a deliberate, thoughtful investment. So not just project-based, but also long-term thinking about how to sustain community responses, how to sustain and resource adequately those community-based and women-led responses that are doing the often invisible labor at community level to support adherence, to answer the questions of people living with HIV who are considering their treatment care and support options. So put plainly, no response is sustainable if it continues to rely on the often unpaid labor of women to fill program gaps. So sustainability planning has to include a dedicated set-aside, clear procurement pathways, so that women-led groups can hold contracts for the roles they already prove they do best: community support, peer navigation, adherence, postpartum retention support. We have to fund these programs. Women's priorities and expertise deserve a budget line. And the last point that I want to make is about peer-led evidence. So one of the core roles and invaluable services that communities provide to the HIV response is community-led monitoring. And the Stigma Index and other human rights documentation efforts are good examples of these. They consistently identify areas where stigma and discrimination are creating barriers to treatment care and support. And it's peer-led, peer-understood data that's unique and valuable. And it's an incredible tool, in particular the Stigma Index, because it brings community together not only to identify challenges and areas where stigma and discrimination are happening, but also to think through how to respond to these challenges and to really think creatively about what it will take to reduce stigma, to support those who are navigating experiences of stigma and discrimination, and how to ensure that health systems are responsive to correcting, reducing stigma, and providing remedy for those who have experienced rights violations. One of the things that the Stigma Index has done is provide sort of big picture data from peer-led implementations around the world and identified patterns. And one of those we have talked about in our Confronting Coercion scan from ICW. And that is that, you know, we have documented a global pattern of coercive practices. These coercive practices are concentrated in pregnancy and feeding, and we need to make sure that our efforts at sustainability and integration recognize these lived realities and address them in the planning. Unfortunately, some of this peer-led research sits outside the national budgeting, but it's a critical resource, and it should be planned for and resourced independently and led by community, but it should be resourced within national budgets. So let me end with 4 commitments from member states and sustainability practitioners. Adopt a gender analysis and rights due diligence process for every sustainability planning effort co-developed with women living with HIV, people living with HIV, and key populations. Guarantee seats at the planning table with power, with voting power, to help ensure that the priorities, needs, hopes, dreams of people living with HIV are directly in the planning process. Adopt the clarion from the HIV, from activists from HIV about nothing about us without us as an operating rule, not a slogan. Ring fence financing for community infrastructure, specifically for women-led community infrastructure, which is often underfunded even within community resources for community infrastructure. And last but not least, institutionalize peer-led evidence. The cancellation of the report, the sustainability report today, leaves an unfortunate gap in accountability at precisely the wrong time. We need member states and partners to commit to resource this report, and we also need to ensure that human rights and gender equality are centered, particularly gender transformative responses are centered in sustainability planning. And I'll turn it back over to you, Nomtika.
Thank you. Thank you so much, Sophie. Very much appreciate as well your emphasis on the recognition and providing legitimacy to peer-led and community-led evidence, as well as ensuring that there is a gender and intersectional perspective in sustainability planning and road mapping. In the interest of time, I'm going to quickly move us to Masugi Tiendum, who is the Technical Director of the National Alliance of Communities for Health, known as ANCS in Senegal, and Director of the Community Expertise Center in Health. He is a social worker and also has a university degree in addictology. He's worked more than 20 years of professional experience in community health, particularly in the field of HIV programming, gender and human rights, advocacy and community health strengthening. Masugi is a civil society activist in Africa for the recognition and valorization of community health actors and the support of local initiatives for the preparation of appropriate responses to epidemics and emerging diseases. ANCS is also an implementer of the human rights monitoring tool, REACT, that is in partnership with Frontline AIDS. So Masugi, over to you and the learnings that we can get from a community and national leadership perspective.
Merci beaucoup, Tika. Je voudrais d'abord...
I would like to first of all thank Frontline AIDS for allowing us to come here and dialogue with high-level stakeholders, but also to allow for community voices to be heard, particularly African communities who are faced with a great number of challenges in terms of their response to HIV/AIDS. To tell you the truth, it has been very difficult for me to prepare this session because I was telling myself that I needed to say something new, but I couldn't because as an activist, everything that I will tell you now is pretty much everything I've been telling you for the past 10 years. Yet we are not in the same context. 10, 15 years ago, I'm sure Christine remembers it, we were going around international conferences with placards in order to say it is a norm. Those living with HIV shouldn't be in the global south, while medicine is in the global north. Nowadays, the only hope that exists in the fight against HIV/AIDS with the injectable PrEP, of which clinical trials have been done in Africa for the most part, and have been done within marginalized communities, with key communities and affected people. And these are available. The PrEP is available in the north, but is not available in Africa. And this is a great injustice. And we have the responsibility as associations who defend human rights, we have the responsibility to end this inequality. I couldn't not share this message with you today. As far as the reason for our gathering here today, many efforts have been done, we have to recognize that, in regards to the integration of programs in Africa, the integration of human rights approaches within the HIV planning processes. I must even say that HIV is now the flag bearer for the integration of human rights approaches in the development of programs in general, health programs and development programs in general. With the REACH program, supported by Frontline AIDS, we have been able to demonstrate in Senegal, or to Senegal, with the REACT system, we have been able to prove the existence of issues linked to human rights violations, notably the violations of key communities, gender-based violence, as well as violence incurred by LGBTIQ plus communities. It was difficult at the beginning because we were being told that you don't have data, you don't have proof. But we have been able, as community stakeholders, we've been able to work with this REACT tool, and we have been able to generate facts, data that are scientifically viable, which we have been able to integrate in the strategic planification of our countries. The issue of human rights of key and affected populations, of women, of girls and youth, is now taken into account in many strategic plans in Africa today, because we have been able to generate data and proof in order to allow for a better planification. The implementation of such plans has also allowed for civil society, thanks to community-led monitoring, has allowed us to do the monitoring of the implementation and to place civil society and civil society actors as key stakeholders in the providing of services, as well as stakeholders who are essential to monitoring and alerting when there are lacks in the services that are being provided. Nowadays, as community actors, we are collecting data, information. We treat this information And then we have accountability processes towards the government, and we tell them what is going on in terms of the HIV/AIDS response, particularly in regards to key and affected populations. Nowadays, the budget crisis has arrived, and everything we had gained is heavily threatened, because the reality in our African countries is that the majority of funds, particularly around HIV, come from foreign partners. Almost 80% of funds in regards to Western Africa come from foreign partners, whether the Global Fund, USAID, as well as other country partners who finance the response to HIV/AIDS. Within this context, we are currently doing a lot of advocacy work on our country level in order to increase the budgets that are granted for such diseases. But it is not easy, because governments mostly do not consider HIV as a priority. We have managed to integrate as a priority the response to HIV, thanks to the support of foreign partners. However, the trend nowadays, it is as if partners were today giving up on this struggle. We are at a crucial turning point. Something new must happen. And what will happen will be with civil society in order to win, or will not be. If civil society is not part of the discussion, we will not win. Because we've also imagined, each time, we've imagined local solutions adapted that give adequate results and that generate a positive impact on the lives of populations, despite the lack of funds, of state funds. We have been able to keep standing. And we must. It is necessary that these communities be reinforced and that they receive the necessary funds to continue this important work. We cannot speak of sustainability unless communities are involved and unless human rights are respected. The strong message I would like to share with you today is to bring partners, particularly international partners, because they are listened to by our states. So we must make sure that integration and implication of communities is an absolute condition in order to receive funds. As long as our states do not hear these types of messages, they will continue to consider not being a priority, to consider our work as not being a priority. And the priority of HIV, respect of human rights, the implication of key populations will not be taken into account unless these messages are heard. And therefore, we must face our responsibilities. And I know that something is around the corner, and I know that together we will win. Thank you very much.
Very much for that insight, Masugi. I'm going to, in the interest of time, pass us over to Blessing Kumawu, who is an educator and human rights advocate from Ghana with a background in basic education. He has worked with CPEG, West Africa AIDS Foundation, and the Youth Alliance for Equality and Foundation. Blessing is currently the coordinator of the emergency hotline operations with Solace initiative in Ghana. Over to you, Blessing, with your 5 minutes.
Thank you very much for this opportunity. It is a privilege to address you today under the framework of the REACT system, which has been a vital tool for documenting and responding to human rights violation in Ghana. At Solace Initiative, we have seen how this evidence is not just data, it is people's lives, their struggles, and their resilience. REACT has allowed us to turn these experiences into actions, providing support, building advocacy, and holding systems accountable. Human rights are central to a sustainable HIV response because they ensure that prevention, treatment, care, and support are available to all, without discrimination or fear. Yet in Ghana, our learnings remind us that stigma, police harassment, family rejection, and healthcare discrimination remain powerful barriers. For lesbians, gay, bisexual, transgender, and intersex persons, these violations are not abstract. They are daily realities that block access to life-saving services. One of our strongest lessons we have drawn from Ghana is that top-down solution alone are not enough. Communities themselves must be at the heart of monitoring, reporting, and shaping the response. This is why Solace Initiative is working to integrate community-led monitoring as a strategy to complement REACT and the hotline operations. Community-led monitoring means giving affected people the tool, training, and support to track human rights abuses and barriers to HIV services in real time. It empowers communities to, one, document their own experiences of stigma violation and service denial, engage directly with health facilities, legal systems, and policymakers to demand change, provide early warnings when abuse escalates, helping to prevent harm before it spreads, ensure intersex persons and other often overlooked groups are not left invisible in the data or the solutions. Our plan is to strengthen this approach by building capacity among community members across all 16 regions of Ghana, linking them with service providers and creating feedback loops so that the evidence they collect leads to concrete improvement in HIV services and human rights protection. Through this, we are not only addressing violations after they occur, but also building a system of accountability that prevents abuses and involves trust between communities and institutions. Colleagues, the fight against HIV cannot succeed without justice, dignity, and equality. With REACT, the emergency hotline operation, and the integration of community-led monitoring, Solace Initiative is working to ensure that no one, irrespective of your gender identity, is left behind. Together, let us commit to a future where our communities are not just beneficiaries of programs, but leaders in shaping them. Because only then can we truly achieve a sustainable HIV response that protects the rights and health of all. Thank you.
Thank you very, very much, Blessing. Ensuring that communities are not just beneficiaries, but leaders in shaping their response. I really appreciate that. I am going to afford us 2 or 3 30 seconds per person for commentary. We've got 2 minutes before we close. If there's any points or questions. Probably not questions, maybe comments. No. Great. Yes, please. Please do intro quickly.
Traice Anushev, Swan Sex Work Advocacy Network. So we are working in Central Europe, Eastern Europe, and Central Asia countries. I'm sex worker by myself. So I just want to highlight a couple of things. When it's coming to the community engagement and community involvement, sex workers are totally on the margins. Like the statistic is saying that HIV funding on global level is coming to the sex workers less than 0.5 from the whole available HIV funding on global level. There is a couple of points what I have. And also I want to talk about the REACT implementation in our region. So there is some things what we as a community, also as REACT program, needs to be more move forward and change because there was like 2022 one report from REACT, it was calling for legalization of the sex work, what is completely wrong. So we are calling for decriminalization. And also in general, when we are talking about HIV fight and AIDS fight in general level, we really need to have a clear, I mean, all stakeholders, including all of you here, we really need to work to have a clear statement about decriminalization, because we cannot fight HIV in criminalized or strictly penalized environment where the sex workers are living and working. Sorry, I'm just rushing because 2 minutes. And the third point, what I want to highlight, what also, this is my third time here in Human Rights Council, and I'm really not hearing debates and narrative what is talking about strict laws. So we are talking about funding crisis, but I think that we are in general in democracy crisis, and it's not only about money, but it's also about how we can continue work even if we have money in the strict and non-democracy environment and political system. Why I'm highlighting this? Because in our region, for community-based organization, specifically for the sex workers, foreign agent law, what is coming, what's imported by Russia and invented in Russia, let's call it like that. Now it's coming also in Europe. We have it in Hungary, we have it in Slovakia, we have it in Georgia, it's going also in some of the African countries. So this is also the thing what we need to discuss, because I mean, we can have a money, we can have a community approaches, we can have a community led monitoring, but if we have these strict laws who are criminalize basically human rights defenders, we cannot do nothing. So I hope that it was not too.
Yes, very much so. Thank you so much. And I very much appreciate the point about having to align as a movement and community about languaging, because decriminalization is where we are wanting to head. And especially what you're also alluding to now in terms of it's a funding crisis, but actually more of a democracy, autonomy crisis. So thank you so much, colleagues. We have reached the end of the session. I think there's some key points that came about around recognizing the legitimacy of community and peer-led evidence, really a stronger emphasis from the previous panel discussion that we've had as well around investing in domestic financing, investing in integration, which will also not happen or happen efficiently if all the barriers to human rights are not prioritized and at the center. And as Blessing just said now as well, communities should not just be beneficiaries in the response, but lead in the shaping and how we are implementing. So thank you so much for making this time. Have a good evening. It's evening now. Thank you all.